Hi, welcome to the Radiology Everywhere YouTube channel. In this video, we briefly discuss the imaging protocol for a patient presented with suspected non-accidental injuries. We are doing neuroimaging as follows. CT head and all premobile children on the day of admission. If there are rib or spinal fractures, retinal hemorrhages, or visceral injuries in an ambulant small child, we can consider CT head. If CT is abnormal or persistent neurological signs with normal CT, MRI brain and spine need to be done. We X-ray the skull. AP, lateral views with or without town view, is suspecting occipital injury. This should be done even with CT head, as horizontal fractures can be missed on CT. Next, for imaging of the body. AP chest X-ray including clavicles and shoulders. Left and right oblique views of the ribs. AP abdomen covering pelvis and hips. X-ray lateral views of cervical and thoracolumbar spines. X-rays of limbs including AP humeri and forearms. Coned lateral X-ray views of elbows and wrists. PA hands and wrists. AP views of femora and tibia fibula. Coned lateral X-ray views of knees and ankles. Dorsoplantar view of feet. Later, we plan for follow-up imaging at 11 to 14 days in all suspected non-accidental injuries. AP view of chest X-ray. Left and right oblique views of the ribs. AP views of humeri and forearms including shoulders, elbows and wrists. AP views of femora and tibia fibula including hips, knees and ankles. Any other suspected areas in the initial survey. A follow-up MRI of the brain within 3 months if an initial MRI scan has been done and is abnormal. If you liked the video, share it with your friends. Subscribe to the Radiology Everywhere YouTube channel. See you soon. Bye-bye.